Okay, so you had to romp through some intelligence theories. Now we're going to actually look at students in our class with differing bookshelves and differing books on the bookshelf. Okay, so let's start off with intelligence and learning. Intellectual ability drives learning. So again, some of that intellectual ability is nurture and some is nature. Okay, some students will come to us with a lot of issues in both their nature and their nurture of intelligence. And some aspects of an intellectual ability can be improved through learning. Okay, some aspects. Not all aspects. We can't restructure the bookshelf, but what we can do is help them put different things on their bookshelf. Okay, and I just like this cartoon. Intelligence testing, big sign is in the next room. Hi, where do I go to take the intelligence test? Just a little haha. Okay, now we're going to jump into kids with different bookshelves. And we're going to look specifically at special education. So basically, if you are looking for a definition, is basically special education is accommodating the special learning needs of students with exceptionalities, and it's specialized instruction based on the assessment of students' abilities. So remember that very first slide, we talked about intellectual ability, we talked about mental issues, we talked about behavioral issues, those kind of things. That's what we're going to be now looking at here. Okay, so I would, as I go through these students with potential mental disorders, I want you to jot down any comments or experience that you have with these disorders or these situations, and then we're going to have a fair bit of time and collaborate to talk about this, because I think in the stories and the relating to the particular individuals, it starts to make more sense once you kind of have a foundation of what these disorders are. Then to have stories around it just makes it that much more memorable in here. Okay, so again, be ready to jot down stories that you want to be able to share in Collaborate. Okay, so Tourette's Syndrome. I'm just kind of going to give you an overview of each of these so you have a sense. So, Tourette syndrome is a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalizations called tics. Usually it's noted in early childhood, and with the average onset usually between 7 and 10 years of age. And Tourette syndrome occurs in people from all ethnic groups. Males are affected about 3 to 4 times more often than females, and the worst symptoms usually happen in their early teens, with improvements later in their teen years and then into adulthood. People who have tics, and a lot of times it will be a sound. It will be a movement. It will be a movement that the student always constantly does. It'll often be where they explode just with words. They'll often swear, and it's again not a vindictive, or they don't have control over the tic. So it's not an on purpose thing to throw off your class. It's they have to. If they try to repress the tic, some people with Tourette's can repress it for a while, but then it erupts, and then it's usually worse. So it's usually better that the child just sort of consistently goes through these tics without repressing and then basically exploding. The cause of Tourette syndrome is unknown, but current research points to abnormalities in certain brain regions, but they still don't know exactly what goes on in the brain of a Tourette syndrome child. Many people with Tourette's also experience additional neurobehavioral problems such as inattention, hyperactivity, impulsivity. It can be treated with some drugs, but there's no sort of wonder drug, no wonder medication to suppress it. And it is usually seen as an inherited disorder in there. Best educational setting for students with Tourette's. They should be placed generally in an educational setting that meets their individual needs, obviously. Sometimes they might require tutoring or smaller classes just so that they are, again, really receiving what they particularly need. And again, a classroom situation and a teacher that has some tolerance for the child, constantly moving or vocalizing in class. It does. I had a young man in a class of mine who had Tourette's, and the first month it was really wild. Like I couldn't quite get my head around, wow, this child is just blurting out, just swearing in class and blurting things out. And then sort of as I got to know more about Tourette's, as I researched more on my own and I got to know the student more, it started to just work. And the students, the other students were very accommodating. Probably more, the students probably will accommodate faster than maybe you will, or well, faster than I did for sure. I shouldn't say that about you, but the child, the child had some additional supports, and there were times when it was frustrating, as the teacher. But again, knowing that the child it was not a purposeful thing, made it easier to include that child in the day-to-day of the classroom. Okay. So again, if you have stories, please jot them down and we'll discuss them in Collaborate time. Fetal alcohol syndrome. This is FAS. So if you hear FAS, this refers to the growth, mental, and physical problems that may occur in a baby if the mother drinks during pregnancy. And some of the structural, actual physical issues that you may see are they usually have small, narrow, small eyes. They might have a small head, they might have a small upper jaw, they might have a smooth upper lip. So you might see some visual and you might not. It really depends when the mother drank in the pregnancy and how much and how consistently. The outcome for infants with fetal alcohol really varies. It really depends, again, on all of those issues. And some of them have they don't have many issues because of their FAS, and some have a lot of intelligence, cognitive issues. I think if you have a child with FAS and the mother comes in for a parent-teacher interview, just be sure that you know if this is the birth mother or an adoptive mother, because oftentimes your FAS kids will be with adoptive mother. If the birth mother comes in, you really need to put your empathy hat on, because no mother purposefully would harm her child if she knew the full ramifications. It's often a survival situation and a preservation of self that the mother drank during pregnancy. So just be cautious. If the birth mother comes in, that is a huge step, because they usually are dealing with a lot of issues and they're usually dealing with a lot of guilt. So just be cautious of any kind of judgment if that birth mother of an FAS child actually comes through your door. Okay, let's talk about Oppositional Defiant Disorder, or ODD. Again, you might have heard this, but it's a psychiatric disorder that is characterized by two different sets of problems. First, there's aggressiveness, and there's a tendency to purposefully bother and irritate others. So this is a very purposeful. The child knows what they're doing. They know that they're being defiant, and then they know that they're being aggressive. Okay, so that is something that you should know about. They often will lose their temper. They'll often argue with adults. They actively defy or refuse. They deliberately annoy people. They often blame others for their mistakes. They're sometimes spiteful and vindictive. So what causes ODD? No one really knows. Again, for sure, it usually starts between ages 1 and 3. It does run in families. If now this I think is a really interesting stat. If a parent is alcoholic and has been in trouble with the law, their children are almost 3 times as likely to have ODD. That is, 18% of children will have ODD if the parents are alcoholic and the father has been in trouble with the law. Kind of wild in there. Okay. How ODD is treated, generally there aren't a lot of studies out there yet, and there's obviously no one way to treat an ODD child. If you have a child with ODD, you cannot get in an argument with this child. You cannot say, you must do this, because they might refuse and they will not give in. You will literally have to physically drag the student out of your class if you want them to leave. And I think you really do need to know if there's an ODD child in your class, if you're subbing or if you are a student teacher, if you're seeing a child that seems purposeful in their aggression and their annoyance, just ask the teacher. And because how you deal with that child, you will have to adjust. You have to give them choices. So you have to say, would you like to do A or B? Because then it's their choice, and it doesn't really matter to you which they choose. You just need them to do one or the other. But if you say you must, you are going to have a fight on your hands. So again, know who is in your classroom. Okay, ODD. I'm just going to read you a little bit of the life of an ODD child and kind of what happens. So here we go. Toby is 10. Toby's day usually starts out with arguing about what he can and cannot bring to school. His mother and his teacher have now made out a written list of what these things are. Toby was bringing a calculator to school and telling his teacher that his mother said it was all right. At first his teacher wondered about this, but Toby seemed so believable. Then Toby brought a little, in Toby's words, knife. That led to a real understanding between the teacher and Toby's mother. Toby does not go to school on the bus. He gets teased and then retaliates immediately. Since it is impossible to supervise bus rides adequately, his parents and the school gave up and they drive him to school. It is still hard to get him there on time. As the time to leave approaches, he gets slower and slower. Now it is not quite as bad because for every minute he is late, he loses a dime from his daily allowance. Once at school, he usually gets into a little pushing with the other kids in those few minutes between his mother's eyes and the teacher's. The classwork does not go that badly now. Between the daily allowance, which is geared to behavior, and his medicine, he manages all right. This is good for everyone. At the beginning of the school year, he would flip desks, swear at the teacher, tear up his work, and refuse to do most things. Looking back, the reasons seem so trivial. He was not allowed to go to the bathroom, so he flipped his desk. He was told to stop tapping his pencil, so he swore at the teacher. Okay, so again, if you have an ODD child in your class, you need to talk to the parents and you need to kind of be on the same page. And again, put that empathy hat on for the parents, because think about how tiring that is to deal with that kind of defiance all the time. Okay, so that gives you a little bit of kind of an insight into sort of the personal side of ODD. Okay, obsessive compulsive disorder. This is an anxiety disorder characterized by uncontrollable, unwanted thoughts and repetitive ritualized behaviors that you feel compelled to perform. It causes your brain to kind of get stuck on a particular thought or urge, and even though for example, maybe you check the stove 20 times to make sure it's really turned off, or you washed your hands, which actually isn't a bad thing in COVID times, but until they're scrubbed raw. Okay, it's not, and I think sometimes we just go, oh, I'm being so OCD about this. I checked for my keys twice. This is debilitating. Becomes debilitating in how you cannot function without doing these things. Okay, most people with obsessive compulsive disorder fall into one of the following categories. So they're washers. So again, they wash their hands till their hands are raw. They're checkers. So they check 27 times, even though they've just checked. They're doubters. They're afraid that if everything isn't perfect or done just right, something terrible will happen. They're counters or arrangers, so they're obsessed with order and symmetry, or they're hoarders. They fear that something bad will happen if they throw anything away. So those are our OCD students. Okay, so I'm going to again just read you a little bit of an example because I think it's important to see that these are real live people that live with these disorders. On the outside, Gail seemed like a very normal person. She went to work every day, was married to her high school sweetheart, and had 2 small children. On the inside, however, Gail felt like a mess. She was distant from her family and locked into the private hell of obsessive-compulsive disorder. She cleaned her house for hours every night after work and screamed at her husband and children when anything was out of place. She would become especially hysterical if she saw a piece of hair on the floor. She was often at the sink washing her hands and made her husband and children wash their hands more than 10 times a day. The children were often withdrawn and upset, and her husband was ready to leave her. On the verge of divorce, Gail and her husband went to a clinic. At first, her husband was very skeptical about the biological nature of her illness. Gail's brain study showed marked increased activity in the anterior gingula gyros, a hallmark for the biological process underlying obsessive-compulsive behavior and difficulty shifting attention. Within 6 weeks of treatment to calm this part of her brain, she became more relaxed, her ritualistic behavior diminished, and her marriage got back on track. So Gail was one of the lucky ones who the medication actually worked, but not all of our students will have that kind of luck or that kind of medical support. Okay. Let's look at visual. I put visually impaired, blind, hearing impaired, deaf here, just so that you are aware that you may have students in your class. Generally, these students, visually impaired, blind, and hearing impaired, deaf, are very independent. They attend our neighborhood schools. They're often aided by an educational, sometimes they're aided by an educational system, but oftentimes they are very independent and they will actually really advocate for themselves. Visually impaired have some sight, blind are completely, they have no sight in there. And again, just be aware. So if you have a hearing impaired child in your class, wear the microphone so that they can actually hear you. If you have a visually impaired child in your class, if you've rearranged the class, just as the child's coming in, be like, hey, I rearranged the class, so you might just want to, or let them in early so that they can go around. But generally, they're very, very independent and advocate for themselves. Okay, let's talk about ADHD because it's I think there's lots of talk out there about how there's so many students now that have ADHD, and is it actually just because we want to label, or is it something that's going on in our society? Like why suddenly, or did we just not talk about it before? So again, as a teacher, you should know about children with ADHD. So basically ADHD is attention deficit hyperactivity disorder. There's also ADD, which is just attention deficit disorder with the lacking hyperactivity. So this ADHD is an emotional disturbance caused by deficiency, imbalance, or inefficiency in brain chemicals, and that affects brain regions. So there's actually there's something wacky with the chemical balance in their brain. There are 3 core symptoms, again, inattention, hyperactivity, impulsivity, and things like inattention is they're easily distracted, they look around frequently, they daydream, they can't focus. Hyperactivity is they fidget and they squirm in their desk, they have trouble staying seated, they talk excessively and in inappropriate times. Sometimes they're super funny when they interrupt, but oftentimes it does become frustrating as the teacher when this child is constantly interrupting. And impulsivity, they just butt into conversations, they blurt out answers in class, they begin work before instructions are given, so then they get confused, those kind of things in there. Okay, so again, we have these kids we will have a child with ADHD in our class, most likely. And sometimes they're medicated, sometimes there's not. There's lots of controversy around medication of young students. But that's, again, something that as in the realm of differentiation, you need to know if the child's on medication, and you need to be in really direct contact with the parents about that. Okay, I'm going to read you a little bit from Joey Pigza, Out of Control, and these are children's books that are written from the point of view of a child with ADHD. So Joey has ADHD and is sort of the narrator of the story. So I'm going to read you a little bit to sort of give you a sense of what's actually going on in the head of an ADHD child. We were on our way to Dad's house, and Mom was driving with both hands clamped tightly around the wheel as if she had me by the back of the neck. I'd been snapping my seatbelt on and off and driving her nuts by asking 100 what-ifs about Dad. She'd been hearing about them for 2 weeks already and wasn't answering. But that didn't stop me. What if he's not nice? What if he hates me? What if he's as crazy as you always said he was? What if he drinks and gets nasty? What if I don't like him? What if Grandma tries to put me in the refrigerator again? What if they make Pablo sleep outside? What if they don't eat pizza? What if I want to come back home? Can I hire a helicopter? Okay, so... Oh, my dog is barking out there. So that gives you a little bit of an idea of how fast the brain is going. The chemicals are in there, and so that gives you a little bit of sense. Again, this is Joey Pigza. If you want to read this series of books, it's a really amazing series and kind of gives you some insight into what the child is, what's going on in the brain. Okay, let's go on to students with autism spectrum disorder. So general characteristics of a child with autism spectrum disorder is there's a wide degree of variation in the way it affects people. So you'll have really a child with autism disorder that is very low functioning and very high functioning, and we're going to talk about what that means. Every child on the autism spectrum has unique abilities, symptoms, and challenges, and again, it's not a single disorder, but it's a spectrum of closely related disorders with a shared core of symptoms. And again, it will vary tremendously on the scale from low functioning autism to high functioning autism in here. Okay, so usually it's a lifelong condition, and the children and adults will benefit from intervention, but there's no one intervention that will really solve autism in a child. So a child with autism will have impairments in social interaction. So often they don't take those social cues that other kids will. They maybe will stand too close, or they hug somebody when the other child doesn't really want to be hugged, those kind of things. They might not be able to share or take their turn. They have trouble with eye contact. Sometimes they won't actually look the teacher or the EA or the principal right directly in the eye. There's social interactions. They may lack the skills to interact. They want to interact, but they just can't. And responsiveness. Children may be more interested in things than in people. Okay. There's also usually an issue with communication. So a functional language, sometimes they just repeat what others say. They can't actually form their own ideas. There's sometimes an issue with verbal language. Approximately 50% of ASD children are nonverbal, so they cannot communicate at grade level. They often have difficulty in sort of that give and take in a conversation. They often will just blurt or just cut the other person off in a conversation, and they have imitation and comprehension of language. They may have an above average ability to read, but with a below average ability to understand spoken language. And behavioral. Sometimes there's unusual obsessions and compulsions. So again, they might be preoccupied with a single television show, or one of my husband's students who was on the autism spectrum had a fascination with toilets, knew everything about toilets. And so they were compulsive. There's this obsession about toilets. They sometimes are very hypersensitive to touch or to light. So sometimes, or to sound. You might have a child with autism in your class that really reacts to loud noises. And so that's a bit of an issue if your class is loud or you're doing lots of group work. And sometimes they will, the repetitive use of objects where they want a certain, they'll have to have their 5 pencils on their desk. And if you move those 5 pencils, the day is over. Or if you have a schedule on your board and then you change it, a child with autism who has behavior impairments just can't, they just can't deal with that. So again, as a teacher, you either don't put the schedule on the board, or you talk with your child with autism and say, you know what, I might change music and language arts around. So are you okay with that if I change it? Yeah, okay, good. And then you go off. And again, they have a wide range of cognitive abilities. So you may have a child with autism that is very, very high in cognitive ability and very, very low. Under autism spectrum is also Asperger's syndrome. And again, Asperger's has very similar traits to autism spectrum disorder, but just you might hear that particular autism spectrum disorder more than others in there. Okay. We also will have in our class students with specific learning disorders. So this is when they have a significant cognitive inefficiency, usually though in just one area. They're usually above or above average in IQ in sort of general intelligence, and sometimes they have considerable cognitive strengths. But there's usually one aspect which is quite a bit lower than every other aspect. There's sometimes a discrepancy between cognitive ability and academic performance because they cannot function in all of the cognitive aspects. It affects their academic performance, and again, it can affect reading, writing, and or math specifically. So let's look at some of these specific disorders. You've probably heard of these. Okay, so these are the ones that are probably the most common are dysgraphia, which is difficulty in handwriting, spelling, or composition. So they actually have real cognitive ability going from their thoughts in their head to actually putting it down on paper. So again, if you have a child that has dysgraphia in your class, and you're asking them to write a 3-paragraph story, they're just actually not going to be able to do it. Okay, there's aphasia, which is the inability to understand or express language. Again, they may have the ideas spinning in their head, but they'll have real difficulty getting it out. And dyscalculia, which is the learning disability in math. I think you often hear people, even I've heard it at the college level. Oh yeah, I don't do math. I just don't do math. There's a little bit of that. There may be something in there that actually is impairing them to do math, but that's dyscalculia. And then probably the most common one is dyslexia. This is a severe impairment in the ability to read. And dyslexia is broader than just flipping letters. That's kind of what we think is flipping letters. There's all sorts of reasons why somebody cannot actually read. It's maybe the color, it may be that everything, that the letters are all backwards, that the letters are different orders, those kind of things. So again, those are the main specific learning disorders that you may come across in your class. Okay, again, please be ready to share some stories. Again, these are students that you will have in your class. You will have somebody with Tourette's or a child with autism or a child with ADHD or dyslexia in your class, and it's imperative that you at least know about the disorder and then potentially recognize it. And ultimately, you as an academic teacher in the class will then, if you have a child with Tourette syndrome, you will then use all of your research skills that you are learning and find out more about Tourette's so that you can be the best and most amazing teacher in that classroom and specifically for that child. Okay, awesome work. We will see you soon.